and we're rounding our back forward and our glutes are switched off and our core is off. And if we do that multiple hours a day, every day for multiple years, eventually what happens is the spine starts to degenerate, the muscles contract and tighten around the front of the core, and the glutes switch off, which helps support the low back. Breathe in and out. How's it going, everyone? I'm Dr. Vear, Advanced Health Chiropractic down in the south of Chicago. And today we're going to be talking about hip dysfunction and low back pain. So normally in today's environment, we're sitting in this corporate environment and we're sitting down at a desk all day, every day. What's happening is that if we don't have good lumbar support and we're not sitting in perfect posture, we're sitting and we're rounding our back forward and our glutes are switched off and our core is off. And if we do that multiple hours a day, every day for multiple years, eventually what happens is the spine starts to degenerate, the muscles contract and tighten around the front of the core, and the glutes switch off, which helps support the low back. And so without that, you're going to start experiencing hip, low back pain, and dysfunction all around. So here at Advanced Health Chiropractic, we do a couple of things to help support and rehab those muscles to help bring them back so that you can be out of back pain as quickly as possible. So a couple of the exercises we're going to show you are going to be for the glutes activation, making sure those are switched on, they're firing, and they support the low back. Alright, so one of the exercises I'm going to show you with my assistant Lewis, Lewis is the chiropractic assistant here at Advanced Health, is we're going to show you a clamshell technique which activates the gluteus medius portion of your glute, and it's going to help strengthen and support that low back when you're having hip pain and low back pain. So what Lewis is in the position right now is you're going to start with your knees together. You're going to bend about 45 degrees right here, and we're going to round the hips forward like this. Rounding the hips forward helps isolate that gluteus medius, and that's what we're going to be strengthening today. And so what I want Lewis to do is keep his ankles together and bring his knees up to touch my hand with his top knee. All the way up to comfy. And down, perfect. Keep those hips rounded forward. I'm going to extend this out a little bit, keep going up and down. And what we're doing right here is we're isolating that glute medius, and so that's going to help keep it up. So keep doing those, and about two sets of 10 is what we're going to do. And then we're going to flip sides, so go on this side. From here we're going to be doing the exact same thing on the other side. So keeping the knees centered underneath the hip, and then 45 degree, 90 degree bend in the knees. Come on up, touch, and down. Good. And we'll do another set of those 2 times, 2 sets of 10. And that's all we got. So the next phase of treatment for the hip and low back is going to be the adjustment. And so what we're going to do is we're going to palpate Lewis's low back, and we're going to see which segments aren't moving properly, and we're going to get an adjustment for that area. So I'm going to have Lewis on his side. His knee is going to be bent right here. I'm going to cross his arms right this way, straighten the bottom leg. And I'm just going to use the knee to help palpate the spine and see which segments of his hip aren't moving very well compared to the others. And I'm just moving up and down his spine, checking which segment. And right there. So once I find a spot, I'm going to pull him a little bit tight, get him in end range. I'm going to contact that same spot that I just palpated. Breathe in and out. And then we thrust, just like that. I'm going to scoot the hip forward, hold the elbow, get to tension. Palpate for hip and low back, right there. Go ahead and breathe in and out. There we go. Grab my elbow. And that's the adjustment for the hip and low back. If you like that video, make sure you like, subscribe. If you're watching on YouTube, make sure you ring that notification bell, and we'll see you in the next one.